Let's talk about a second solution to the dataset size challenge. The idea is to trick the network into thinking that we have more training examples at our disposal than we actually do. Right before we pass an X-ray image into the network, we can apply a transformation to it. We have several options here. We can rotate it and pass it in, or we can translate it sideways and pass it in, or we can zoom in, or we can change the brightness or contrast, or apply a combination of these transformations. This method is called data augmentation. In practice, there are two questions that drive the choice of transformations we pick. The first is whether we believe the transformation reflects variations that will help the model generalize to the test set and therefore to real-world scenarios. For instance, we might believe that we're likely to see variations in contrast in natural X-rays, so we might have a transformation that changes the contrast of an image. Our second design choice is to verify that our transformation keeps the label the same. For instance, if we're laterally inverting a patient's X-ray, this means flipping the left over to the right and the right over to the left, then their heart would appear on the left-hand side of the image. This is the right of the body. However, the label of normal would no longer hold because this is actually a rare heart condition called dextrocardia, in which your heart points to the right side of your chest instead of to the left side. So this is not a transformation that preserves the label. The key here is we want the network to learn to recognize images with these transformations that still have the same label, not a different one. Beyond X-rays, there are other useful data augmentation procedures for other tasks. Rotation and flipping are useful for algorithms trained to detect skin cancer, for instance. In histopathology, one large source of real-world variation is different shades of pink and purple seen in these microscopic images. Color noise is often added, and all this does is have slightly different shades of these pink and purple colors to help the network generalize. In addition, rotation and cropping are also useful data augmentation procedures for histopathology images. As a recap, we've looked at the weighted loss and the resampling methods to tackle the class imbalance problem. We've looked at the multi-label loss to allow the network to identify multiple diseases in a chest X-ray. We've also covered transfer learning and data augmentation procedures as ways to tackle the challenge of having a small training dataset.